All right, I think we are ready to get started. Thank you all so much for coming today to participate in today's workshop that's sponsored by the Checkup team. And the purpose of this workshop is for us to talk about best practices for communicating with our community partners in order to advance health equity. We hope you find today's session useful, and we want to give you an opportunity to learn about some of the best practices that we've learned over the years related to communication. Next slide. So I'm Dr. Rodlescia Sneed. I am a co-investigator with Checkup. I'm also a community engaged researcher, and I'm on faculty here at Wayne State with a joint appointment in the Institute of Gerontology and in the psychology department. And I have two co-presenters here with me today from my research team. The first is Kayla Habermehl, and Kayla is a science communications specialist who has been doing work in the communication space for more than 10 years. She also is currently working towards her master's degree in public health. And before moving into public health, she worked as a journalist for MLive. We also have with us Sarah Clark. She's a graduate student here at Wayne State in the psychology department. And she's done a lot of community engaged research focused on community mental health and homelessness and poverty. Next slide.
Alrighty. So with this in mind, we want to talk a little bit about what community engagement is. So we're providing these definitions so we can all start from a common place of understanding, even though these might look familiar to you. So community engagement is really how we're working with these communities. So this includes building equitable and meaningful relationships with these communities to then address those health issues with them. So when we think of this, it's really important that we see community engagement as not coming in as, external experts telling them what to do, what not to do, things of that nature, because that approach can often come off pretty condescending, right? And frankly, it's often ineffective. So rather, we want to make sure that community engagement necessitates this collaboration with our community to help identify the problems that they may be experiencing and explore solutions with keeping in mind barriers and things of that nature, again, with the community rather than for the community. So the purpose of this workshop, we're going to determine the most effective means of those kinds of communications. And this really means that we're trying to meet people where they're at, that we're showing up to humbly listen and learn and foster that respect, empathy, and humility in tandem with the community.
Perfect. So to build on what Sarah said, in terms of the relationship between community engagement and communication, I mean, communication is really how we do community engagement, right? It's how we connect with people and communities. It's how we identify problems and develop solutions. And it's how we share news and information about our work so that it can have a broader reach and impact. I like to say everything is communication, right? What we're doing right now is communication, the emails we send, the conversations we have, when we wave to someone, walking by in the street, when we invite people, even down to the messengers that we pick to share information with folks, right? All of that contains information beyond just the words that we're using. So we're going to talk about some of those things today also.
And so if any of you have ever been to any of our previous checkup workshops, you often see that we put up this figure that talks about the continuum of community engagement. And this is really a framework that we use to illustrate the varying levels of involvement that community members can have in decision-making processes. And so when we talk about communication, it's really important to think about this continuum because the flow of communication really varies based on the level of community involvement. So if we look to the left and think about something like outreach, for example, outreach usually involves us doing one-way communication. So it may be the academic partners relaying information to community partners. And in that case, community members are primarily receiving information. So this might be a press release that we issue, or it might be giving a presentation to community partners about our plans to do certain types of work. So at the outreach level, we're really talking about that one-way communication. As we move further along the continuum, we get to involvement and collaboration and shared leadership. At that point, we're really talking about bi-directional communication. So it's a two-way exchange of information and ideas. So rather than just being academic partners sending information to community members, instead, what we're doing is academic partners may be communicating information, and then our community partners are communicating as well. And so having that two-way exchange is really important in order to ensure that all of the parties are actually benefiting from the partnership. Next slide.
So let's discuss a few ways that we do that, right? Like how we actually build communication into our community engagement and vice versa. So one of the first strategies might seem pretty obvious, but it's to meet people where they are. This is really a critical part of both community engagement and communication. If we want to successfully reach people, we have to do it in a way that works best for them rather than, what might work best for us or what we think might work best for other people, right? Especially as we're building and those relationships with potential community partners. So this really means understanding your audience, understanding your potential community partners. Do they prefer in-person communication? Do they prefer written communication? Do they trust certain messengers versus others? So when possible to going physically to them is important, especially in the beginning. And that could look like attending events in the community or hosted by the organization, talking to people, getting to know them, really laying the foundation of that relationship before you need something from them, right? We really want to avoid things that feel transactional and cold and extractive, right? We really want to build these sustainable relationships. If you do end up inviting them to, say, campus, for example, you want to consider and address the barriers that they may face in getting to campus. So finding places for them to park, making sure parking is validated. If they need transportation, ensuring that folks have bus passes, picking accessible buildings, making sure that the spaces we're inviting people to feel safe. And then taking timing into consideration also, right? If people are working during the day, we probably shouldn't invite them during the day. The second point is to employ cultural humility, right? In short, this is the idea that we don't know everything and that we're humbly willing to listen and learn from folks, recognizing that people in the community are the experts on their community. Communication doesn't work as well if we approach it with kind of this rigid thought of what we really want people to know without considering their context and their experience. Instead, we should reframe a little bit and think about what the audience might need to know to act, what information they may want to know, what problems or barriers they may face, and then tailor our information, our approach, and how we get the information to their circumstances. This is kind of a subtle but really important distinction, right? Shifting from what we want as communicators and public health folks to what works best for community members based on their self-identified needs. And then this last one is to choose our messengers carefully. So often the messenger is just as important as the message, particularly in groups that have been historically excluded or under-resourced, right? People trust people they know more than they trust a random person that just shows up one day or even an organization, right? So the people that we choose to convey our message are really important. So when you're thinking about this, really think about who from your team might be best to do that. It may not be the PI or the science person, right? It may be a health educator who already is working in that community or knows folks. So really think about who that might be and then tailor your process around that. Next, we're going to jump into this 3 pillars of communication. So you may have seen other communication frameworks before, and they're all great. They all have great things to say, but really you can distill all of that down into these 3 main things, right? Message, so what we're saying to people, audience, the folks that we're saying it to, and then vehicle is how we say it and the messengers that we choose to say it. So this could be verbal, like a face-to-face conversation. It could be email or something like that. So we're going to dig into all of this a bit more as we go through. So starting out with message, this can be really, really tough, especially for folks in academia, right? Our work can be really complex and nuanced, and often, we can't throw all of that at people. So one of the main challenges also is that our messages don't exist in a vacuum, right? How we develop them, deploy them, and how they're received by people is affected by our worldview and experiences, and then our audience's worldview, experiences, their environments, their access to resources, all of these different things. So as communicators, it's kind of our job to really strive for that shared understanding, to think about how these different things affect our messages, and then how it also affects the folks that we're talking to and adjusting for those things. So again, it can be really daunting to take really complex issues and distill it down. How do you cut through that noise? How do you get the message across without getting lost in the details? One strategy is to focus on the impact of your desired outcome. And these two questions I find can be really helpful. So I work a lot with biomedical scientists who always look a little bit like deer in the headlights when you ask them to take, 10 years of work and distill it down into maybe a couple sentences. And these questions can be really helpful. So the first one is, if people only remember one thing, what do you want it to be? The second is, what problem are you trying to solve and why is it important? The first one can be really helpful if you have results that you're trying to share with folks. The second is a little more helpful if you're kind of at the start of a program, right? You're trying to get buy-in or maybe recruit people to join you to address a problem. So these questions help you kind of figure out the so what, why should people care? Why does the information matter? Why is it relevant to folks in the community? And these will help you pick your main takeaway, which we're going to discuss next as part of this 3-point strategy. So this can be a really powerful way to take really complex things and make them much easier to understand. So the 3-point strategy is a way to identify and refine your main messages. It starts with a main takeaway. That's that one thing that you really want folks to remember and kind of carry through. Your other 2 points should be kind of supporting messages that go along with that takeaway, right? What else do people need to know to act? Why should they care? Is there something we want them to do? Is it acknowledging a barrier that we know exists and offering a solution for addressing that barrier? So as you think about these things, one important thing to remember is that it's not that these will only be the only things that you share with people. These are kind of the scaffold around which you can build all of your communication stuff. It's really helpful when working with partners, especially if they're developed in partnership with those folks, right? Because it helps keep everyone on the same page. It's kind of an exercise in coming to agreement and consensus. And especially in more fraught or crisis situations, if you have a lot of partners, it makes sure everyone's on the same page, and that's important for trust building. So what does that look like? This is just a quick example we pulled together looking at colorectal cancer as an example. So these types of cancers are skyrocketing in young people. We don't really know why. And it's a big problem because a lot of people don't catch these cancers early because they're too young to start screening, right? So you can imagine in a public health context, if you're trying to recruit community partners to address this and raise awareness, you might think of how you communicate that to them. So if you go through the exercise of asking these questions, what we come up with is, these cancers are becoming more common in younger folks. Strong partnerships in the community can help us tackle this problem. And then, you can join our group today to do that. These are really simple things. And it's not that you present these verbatim to people. It just gives you kind of a core thing to build everything else around. Here's another example of what this looks like in real life, if you will. So this is a partner document from the World Stroke Organization. This is given out to folks who partner with this organization to raise awareness for stroke. And it's really long, but you'll see on the first page of this guide, here is their high-level takeaways, their 3 points that really matter, right? So prevention is greater than stroke. That's the big takeaway. Strokes are really common and they can be prevented. These are their main takeaways, and you'll see these written in different ways throughout this document, but the message is the same. Even if the words shift a little bit or the way it's presented shifts a little bit, these are still the main things. And you'll see that here too. This is later in the document, and it's the same thing. Prevention, it's common, it's preventable. There are things that we can do. So as we're talking to community partners, and providing information to them, looking to build those relationships, really thinking about those messages that we're sending to folks to help bring them along, and then be able to work with them to develop messages that go out to the public, right? It's really important to get that community feedback there. So at this point, having just talked about this, excuse me, we are going to practice this a little bit into some breakouts. So what we're going to do is walk through an example together of what developing these messages look like. And then we're going to be assigned out into breakouts. You'll have a moderator for each group, and we're going to ask for volunteers to allow us to talk about their work. And if not, we have a common example that we can use as well. So let's walk through this a little bit with this 3-point strategy. So you're organizing a coalition to improve diabetes outcomes among Detroit residents. You have some community partners, but you're missing participation from some of these key groups, right? So the LGBTQIA community and Middle Eastern, North African communities, all of which have these higher diabetes rates. So thinking about what kind of messages that you would use to reach partners from this community. Does anyone want to drop maybe thoughts in the chat on what you might do using this higher level strategy? So thinking again about what you want people to remember or the problem that you're trying to solve. So if I was going through this exercise, I would immediately think, the big takeaway we want people to know is, one, that this is a problem, right? Diabetes is a problem in these communities. And then thinking about what would make it really meaningful to folks, right? Well, we all want our friends, family, loved ones, neighbors to be happy and healthy, right? So maybe the next message is there are things we can do to prevent it, and preventing it will allow the people that we care about to be around longer and live better lives, right? So if you think about how those messages stack together, that's one approach. Another approach might be to say diabetes is preventable, it's a problem, and we know there are barriers to doing that, and we have a plan for addressing those barriers. All right, so I think now we're going to go into breakout groups. This will stay up on the screen so you can see the prompts and then some examples as well. All right, so before we move back into the rest of the workshop, does anyone want to share anything from the breakouts, things that you discussed, or maybe examples from your own work?
Yes, I would like to. I'm Karen. I would like to share. We had a very good breakout session with Wilma and myself and Kayla and everybody. We were talking about how you have to make these things interesting and not make people bored with listening to what you have to say. And you can do that by videos and telling stories and cartoons and, other forms of animation, and how we have to show them the importance of, how it relates to their communities, like the Middle East community, the African American community, or the LGBTQ community. And also, Wilma was talking about how bringing in a celebrity who they trust, that's a big thing, and also making them participate by making them the researcher and we're the participant, flipping it back on them, where they can give us the information and we can know that they understand what they're doing.
Awesome, thank you. Does anyone else want to share anything before we move on?
I think our group really found that we needed to know some preliminary information first, so that when it's not going in there sort of willy-nilly and not being able to be on target. And so we should ask what they feel like some of their key issues are. And so, and sort of building things around what they're saying, but still using those 3 points to really frame a clear message and some action steps that maybe could be helpful.
Yeah, those are great points. Thank you. All right. Last call. Does anyone else have anything they'd like to share?
Well, I'll mention in our group, the examples that people worked through both were about recruiting community members to participate in research. And so in most cases, the main message was kind of, this is the purpose of the research study. So in many cases, people were doing a research study to learn about community members' experiences. And then the kind of, why does this matter? Our group members talked about, learning experiences helps us to develop interventions to address some of the challenges that people might be facing. And then finally thinking about kind of that third message, like what is it that you want people to do? So we want people to sign up for a research study or look out for future communications from us. And so the examples that folks shared in our group kind of did those things.
Perfect. One thing I'll mention too from our group that was brought up pretty early was the importance of language, right? And using language that resonates with the community, which we'll talk about in a little bit. But with diabetes, knowing what folks in the community call it. So if they call it sugar or something else, right? Using words that mean something to people rather than like kind of clinical, technical words. So great. Well, thank you all so much for sharing. Hopefully we'll have time at the end too for questions and additional conversation too. So we're going to just move on then. Let me just get my slides together. So this, we kind of touched on this a little bit in our group, but just like how you talk to people, right? How you communicate with people. And I think a lot of folks from academic backgrounds or scientists kind of think about, putting things in context first, like the background of the information, then you get the details, and then your takeaways at the bottom, right? So you think about like an academic manuscript, you've got your introduction and your methods and all of that, and then your discussion at the end, and your abstract at the top. But most people in the public think about things this way a little bit, right? So the takeaways at the top, that's the most important thing. And that's where those 3 messages kind of come in, right? Those are your takeaways. Those are the most important things. And making sure that that's up top. Like if you want people to know something, tell them. And then you can provide the detail, why it matters, that background supporting info, but just kind of flipping the script a little bit on how you structure the communications, just to make sure, one, that, if you want people to get a message, they're getting it. Especially if you're doing something written, everyone's busy. If you're using email, like everyone gets a million emails. So making sure that info is right up top and that it's really clear will help everybody out.
All right. So the words we use really matter, right? They carry a lot of weight, and they're what are the chaperones for our messages, and they help ensure a sense of fidelity from sender to recipient. So word choice really conveys much more than just the meaning of the word, right? It conveys our feelings, our knowledge, and our bias on a subject. So for example, if you're working with the LGBTQIA+ community and you're assuming someone's gender or not asking for their preferred pronouns, that conveys either a bias or a lack of knowledge or even respect, right? So we want to make sure that we don't use stigmatizing language or anything of that nature, because it can be really damaging to those relationships we're trying to build with our community members. So use of that language can oftentimes be unintentional, or we may not even realize that these words are hurtful or problematic. And that's another reason why it's really important to work closely with our community partners, because they're going to be the people who are cluing us in on these things, right? It's just like we can find a bunch of information out on the internet, whatever, but that doesn't always mean that it's the right fit for our communities, as they're the experts in their experiences and things of that nature. All right. So one way that we can avoid using inadvertent insults or anything that may be offensive is to employ destigmatizing and person-first language. So when we say person-first language, we mean choosing language that recognizes and prioritizes that agency that an individual has, rather than focusing on a disease or a disability or a current circumstance that they may be experiencing. So destigmatizing language seeks to remove that shame and stigma from some of those words that we might be using, which can kind of take off that judgment piece and in turn kind of preserve those relationships. So there are many resources available to foster this inclusive language, including a guide from the NIH, and that'll be provided to you guys later for you to use. However, close community collaboration is the best way to ensure these successful word choices. So one example that I'll give, especially with using that person-first language, I do a lot of work with people experiencing homelessness. And if I were to be writing like an article or something of that nature, the PC word that I would use is unhoused, right? But when I'm talking about it, I say people experiencing homelessness because it's an experience rather than a character trait. So that's just one example. And then you also want to be mindful of like mirroring the language that people are using with you. So that's one thing, like you don't even have to ask sometimes, but be intentional about listening how they talk about themselves and their experiences and mirroring that language back to them.
So we have a few additional communication tips that we think are really useful when you're trying to talk to community partners. The first is to be really empathetic about the fact that some of your partners may have some challenges that impact how you communicate with them. So for example, I do a lot of work with older adults. And oftentimes older adults have vision impairments, and that might impact how well they're able to look at written information. So if I'm trying to give written information to an older adult, I want to make sure that the font size is really large in any documents that I give them. I want to make sure that the colors I use are going to be really easy for them to read. It's important to think about the structure of the sentences that you use, both in conversation and in how you write. So I know in my own work with older adults, sometimes they don't process information as quickly as younger people do. So it's really important to have really simple sentences and not to put too many ideas into one sentence. Also, making sure that we slow down and pause when we talk to people. So again, older people, sometimes it can be difficult to process information quickly. So we really want to slow down and make sure that we're giving people enough time to process what we're saying. Also, we want to think about the kinds of questions that we ask people. And if we're talking about conversations with people, our goal really is to hear what they have to say as opposed to just getting a quick response. So it's important as much as possible for us to ask open-ended questions rather than just yes or no questions. So let's say, for example, I have a community partner and I'm interested in learning about their experiences accessing the healthcare system. Instead of saying, do you have access to healthcare, which is a yes or no question, it's better probably to say, tell me a little bit about your experiences accessing healthcare. That really invites people to engage in conversation as opposed to just giving you a quick yes, no answer. And then finally, when you're communicating with people, making sure not to use a lot of slang or idioms. So we know that slang and idioms vary quite a bit cross-culturally and also across generations. And so we don't want to alienate the people that we're talking to by using slang or idioms that they might not understand. So as much as possible, avoiding use of these slang and idioms can really help. Next slide.
Sorry about that. So to build on what Dr. Sneed was saying too, a big part of knowing and employing all of those things is really knowing your audience, right? So regardless of who you're talking to, what you're communicating, when you're communicating it, knowing your audience is really important. It's the folks that you're talking to. So that will inform how you convey the message, who your messenger is, what you say. And some things to think about when determining your audience are these framing questions, right? So who is affected by your topic? Who cares about it? And the difference there is, people who are affected by it could be folks actually experiencing it in the community. So say folks with diabetes, but people who care about it could also include public health folks, medical folks, maybe policymakers or grant funding organizations who, provide funds to do programming, right? And another set of questions is, what do you know about the audience, right? Are there cultural, social, religious factors? All of that information is really going to help you get to know folks, identify potential community partners, and be able to tailor your messages to them. And regardless of who you're talking to, we talked about this a bit earlier, right? Is kind of employing cultural humility. And here's CDC's definition, which again is pretty in depth, but again, it's just admitting we don't know everything and deferring and respecting the folks who know about their community. So these are just a few tips for enhancing cultural humility. Starts with just examining your own experience, right? Considering your social position and how all of the things that you've experienced influence, potential biases, the way that you think about things, the way that you communicate, and realizing that impacts how you communicate with other folks. Respecting differences is pretty self-explanatory, right? Just respecting other people's belief systems and cultural structures. Listening and learning, really actively listening to folks when you're talking to them, maybe asking some follow-up questions, and recognize that they're the experts, right? And that you're kind of the learner in that situation. Pursuing multiple benefit, that's equity, right? And if we go back to that continuum that Dr. Sneed showed earlier, of community engagement, right? We really want to strive for shared benefit, shared leadership, and really involving the community in our work. Enhancing accessibility. This basically means just to communicate in ways preferred by the community, and thinking about barriers that folks might face and addressing those barriers, right? So as Dr. Sneed said in the earlier slide, like when working with older adults, really thinking about how we make things really readable. Maybe that's making the fonts bigger, or maybe they prefer communicating in person, so we do that. And lastly here is avoiding hierarchies, right? It can be, when we're communicating really complicated topics, especially science and health things, right? We don't want to come off as paternalistic or condescending. And that can occur sometimes when we're trying to explain something and maybe the words we're using are too technical, or it just feels like we're getting into too much detail, but we're missing maybe the message. So really thinking about how we do that, the words we use, and really infusing these cultural humility practices into our work.
So one thing that people often ask is, how do I go about identifying partners to work with? And the main thing that I always tell people is that you're not going to find partners just sitting at your desk, right? You have to actually be in community to engage community partners. So what does that mean? Sometimes that means going to community events. This is especially important if you're trying to engage a community that you don't belong to. And so going to community events can help you to kind of understand the history of the community, understand community norms, and really demonstrates that you care enough to get information and to listen to community members. Oftentimes you may have colleagues that already have relationships with people in the community, so it may be helpful to ask your colleagues to introduce you to prospective community partners. As much as possible, it's best, at least when you're making initial contacts, to meet in person. People like to look at the person that they're talking to. People rely on cues, visual cues quite a bit, and body language quite a bit. So as much as possible, trying to meet people in person is important. You also want to avoid engaging in communication that's cold and transactional. So when you're talking to community members, it should be more than just, what are you going to do for me? It's really important to think about how you're actually going to build relationships with community members. And then finally, just doing your homework. Don't assume that there aren't community members already out there that are working on the problem that you're interested in, and really just kind of taking the time to do your research on groups working in the area to figure out possible connection points. And so when we talk about building rapport with community partners, there are a few best practices here as well. So first of all, it's really important, as we've been emphasizing over and over again, to use the preferred methods of your community partners. So we may have some partners that don't mind email, but we may have some partners that, tell us, if you want to communicate with me, pick up the phone and call me. So kind of really pay attention to that and be mindful of that. It's also really important to check in regularly, not just when you need something. So I have a partner, for example, I make a habit of making sure that we have lunch maybe once a month, not just when I need something from them, but also just to kind of nurture that relationship. And sometimes we might talk about the project. Sometimes we might just be talking about what's going on in our lives, but it's a way for us to really make sure that we're forming real connection. Also think about how you can share stories to create connection. So trust is issue with lots of community members. And in my experience, community members want to know that you're there doing not to advance your own career or to make a name for yourself, but because you actually really care about what's happening in community. So as much as possible, if you can share stories that demonstrate your commitment to the work and your commitment to the community beyond yourself, that's really helpful. Also, something that's really important is having integrity in how you interact with community partners. So if you tell a partner that you're going to do something, do it. And that seems really obvious, but sometimes, as academics, we're not necessarily very good at making sure that we follow through. Sometimes things happen and we're not able to do the thing that we said that we were going to do, but it's important to communicate that as well. So, if you find that things change and that you need to take a different course, it's really important to communicate that to your partners. And then finally, thinking about what kinds of accommodations you might need in order to reduce any kind of barriers that your partners have in participating in your work. So you may have partners who have childcare needs. They may have small children, and that may impact the extent to which they're able to participate in activities. So it's important to think about that. Are you working in a community where there's a lot of food insecurity? And if so, having meals at community meetings goes a long way in ensuring folks are able to participate. So really kind of just thinking about what kinds of accommodations are needed to reduce barriers to participation.
All right, and now I'm just going to briefly share a little bit of an example of some of the things that we've been talking about, more specifically to kind of, accessing the population or the communities that I'm working with and doing that appropriately. So one example from some research that I've done, I did an on-site health intervention at a men's homeless shelter. So for participant recruitment, of course, I used the old reliable flyers, right? And I created this flyer and I put a couple visuals, graphics on it for aesthetic purposes. And I said, wow, this looks like a great flyer. And I hung it up, right? But I also did my clinical work there. And one day, one of my clients took me aside and they shared with me, like, what does this say? I actually can't read it. Like, I'm not able to read. And it really kind of helped me take a step back and realize that I'm not really reaching all the people that I'm trying to reach within the shelter because of how I've presented this information. So we were actually able to sit down together and kind of redo the flyer. And for each line of text I had, I was able to have some sort of visual cue kind of communicating what was going on and what was going to be done during these sessions. And this was really important. Afterwards, we kind of were able to make it a really collaborative experience. I kind of had a little like working group, if you will, of guys that I would meet with and I would show my materials. And we had a lot of fun with it, right? So it's something that not only kind of helped me take a step back and make more effective communications and materials that I was using, but it also really kind of built that rapport, right? And it gave that sense of empowerment that they're part of this process too. They're not just attending the interventions or the sessions that I'm running, but they're helping build this experience within their community as well.
And I'll share a little bit as well, and just kind of thinking about the work that I do with older adults. So I've already mentioned a few things in terms of working with older adults, thinking about things like vision impairment or processing speed and how that might impact how we engage with older adult partners. Something else I think about a lot in my work as well, if I'm going to have meetings with community partners that are older people, sometimes I have partners and they don't drive anymore, partly because of, vision problems, or maybe they don't have a car. So what does that mean if I'm trying to actually engage with them? Oftentimes that means going where they are, or if we're going to a community meeting together, picking them up so that we can go to the community meeting together, and really just kind of making sure that transportation isn't a barrier, because I know that that can be a barrier in working with older adults. Additionally, thinking about when you have meetings. A lot of older adults tell me they have safety concerns about going to meetings in the evenings, for example, or they're more alert at the beginning of the day. So kind of keeping that in mind in how I interact with them, and trying to make sure that we have meetings in the mornings, because that might be a better time for them to engage in meetings with us.
All right, thank you both for sharing that. So we talked about audience, we've talked about message. So we're going to talk a little bit about vehicles. And so in Sarah's example, the flyer was the vehicle, right? That was the way that the message was conveyed. So there are a few different ways that you can do this. There's written stuff, there's verbal, so like in-person discussions, and then there's visuals. So that's your flyers, your graphics, your photos, the slide deck. And obviously you can kind of combine these things, right? You'll have something that's maybe got a visual component, maybe something that's spoken, but in general, vehicle is the thing that you use to convey your message. So when you're thinking about the vehicles that you pick, it's going back again to audience, right? Really thinking about the communities that you're serving, or the communities that you want to work with, the folks that you want to talk to, the topic that you're studying, and thinking about these questions. So which vehicle best tells your story or conveys your message, right? Is it something that would really benefit from being visual, or is it something that maybe is better in a conversation versus an email? How does the audience prefer to receive information? To Dr. Sneed's point earlier, sometimes in person is best. A conversation is best. Going and talking to folks is best. And maybe there's a follow-up email or some sort of written follow-up, but that initial conversation is in person. Which vehicles are trusted by the communities? Oh, yep, I see a hand raised.
Yes, I just wanted to add to that last one about, the different vehicles, that you can use. Sometimes you have to use a combination of vehicles, because one thing that works for one person in that group may not work for the other person. So
Yeah.
sometimes you have to use a combination of maybe emails, or calling them on the phone, or one-on-one discussion, or maybe even a brochure, a flyer, or what have you, because everybody in a certain group, say for instance, it was people that have a heart failure or whatever, they may receive information differently. And sometimes I know I read all my emails, I read most of my text messages, but sometimes, you know, I'm a little slow at calling people back, but I do get to it, but I read everything and I absorb that and I ask questions. So some of these flyers may make the audience, they may generate questions, that they have to be able to contact you in order for you to answer. So it might be good that on some of the flyers or brochures that you put a contact information, like your email address and or your phone number, so people can, if they have a question about it, they can call you and get an answer. And just like Dr. Sneed was saying, that she works with older people, a lot of older people may not, be as much into emails and text messages. They may, it may be about calling and talking to them on the phone. So I just wanted to add that in there.
Yeah, that's 100% spot on, really important. I always call it the QR code question, right? Like for a while, QR codes, those little barcodes were everywhere. And, to use those, you have to have a smartphone, right? So people stopped for a while putting websites or email addresses on things and just said, scan this QR code. Well, if you don't have a smartphone, that person can't do it, right? So you're kind of cutting someone off from the ability to reach out. So I think what you said is 100% correct, right? We need to give people different ways to get in contact with us, make it really, really clear what those ways are, and think about the barriers that people might face to that, right? Is there a technology issue? If they don't have a smartphone, or they don't use email, then we give them a phone number, or Maybe it's saying, you know, here's someone at this building that you can reach out to if they prefer to go in person, but that's 100%. Yeah, we just talked about the barriers, accessibility considerations, right? This comes down to visuals a lot too, right? If you have someone who has low vision, are you using fonts that are big enough? Are you using colors that are really high contrast? Are you providing something that can be read by a screen reader, right? So this is a big issue on social media with videos and images, right? So when you put a video together, are you providing captioning that can be read by a screen reader for folks who use that technology? Or if you use an image, are you using alt text, which is a description of the image so that folks who maybe can't see the image still have access to that information? And then thinking about what resources are available to create all of this content, right? Because as we just discussed, you can't often just do one thing. You might have to do a bunch of different things and tell your story or share your messages in different ways. What resources do you have to do that? Can community partners help out? Do they have expertise in certain communication channels or tips or tricks that they use that they find really effective? This is where that conversation comes in again, right? Because again, these folks are the experts. They know what their audience likes to use for these vehicles and can really help shape that. So it's all really great insight. So thank you for sharing that. So regardless of what vehicle you're using, really regardless of your audience, everyone can benefit from using plain language and simplicity. And this is where it can get really tricky with science and health stuff, right? Because it's all really complicated. But we want to bring folks along with us. We want to communicate what we're saying. So we talked a lot about this in our breakout group, right? Of using the language and the words that people actually use and not jargon. So these are just some basic tips and tricks you can use. There's this link down here, this NIH plain language guide. That's great. You don't need to, if you want this, we have some free resources that we'll share with you all after with a bunch of links. So we'll provide that at the end. We talked about this a bit. Be direct, put your main message first. Keep sentences short. Stick to 20 words or less is generally the rule. And this helps ensure that you're not cramming too many ideas into one sentence, right? And it just makes things more readable and just helps keep what you're saying really clear. First person language, which is different than person first. So first person is just a friendlier way to say things, right? So saying call us if you have questions versus participants can call. Oh, yep, I see another raised hand. Go ahead.
Have a wonderful
Okay.
weekend.
Just the notion that the jargon
Mhm.
can really throw
Yeah.
individuals, and it's not to belittle their intelligence.
Mhm.
And that can be coming from the academician as well as the healthcare provider.
Mhm. Yeah, really, really good point. Jargon is tough, right? And I think it can be, at least because I work with a lot of scientists, and they'll tell me, well, jargon is really precise, so that's why we use it. And my reply is, okay, but if folks don't know what you're trying to say, or they don't, you have the benefit of having a PhD and having all this background info, right? Not everyone has that. So we need to be really accessible and bring people along with us, right? So the advice I always give is, if there is no other way to explain something, and there usually is, but just explain what the term means and try to find ways to make it accessible and bring folks along with you, because you're absolutely right. If you start throwing jargon at people, it's kind of a roadblock to understanding. Absolutely. We have a little bit about jargon in here somewhere. I'm just trying to remember where it is. But another tip that you can use is to use positive framing with this stuff, right? So what that means is you tell people what you want them to do, not what you don't want them to do. So if you have folks coming to campus, right, to visit, telling them to use an entrance to a visitor lot versus not using that. Oh yeah, great point in the chat. The responsibility is on the sender, not the receiver. Absolutely 100%. And then using common words, that's where it is. There's the jargon, right? So heart disease versus cardiovascular issues, or instead of saying, myocardial infarction, saying heart attack, but really thinking about ways that words that we can use that enhance understanding and aren't a barrier to it. So one that I see a lot is people using incidents, right? The incidence of this disease. Well, you could say new cases, right? And that's far more understandable. I see a note in the chat too about acronyms. Absolutely. Always explain acronyms. And I actually suggest, unless the acronym is really well known, like everyone knows it, to not use them, because what you can end up with is just kind of an alphabet soup of acronyms, especially if it's written. And then you're relying on the person to remember what all of those acronyms mean, right? And so they're spending time trying to remember the acronym instead of really thinking about what you're saying. A few additional tips here: removing filler words, especially in writing. So when you're talking to folks, this one's not as big of a thing, but in writing, cutting out very, actually, really, those kind of things. It just streamlines your messages. It makes them a little bit tighter, and it saves you a bit of space. Using active voice, again, it's just a friendlier way to chat with folks, and it makes things a little bit clearer. So our community advisory board will meet August 1st. The community advisory board is doing the thing, it's meeting. In this example down here, it's backwards, right? The meeting will be held by the advisory board. So it almost detaches your message from the folks that you're talking to. It makes it a little less connective. It also can be perceived as like a bit evasive too. So anytime you can use this active voice, like we are doing the thing, you'll be in great shape. And get a second opinion. So we've talked about this a lot. A few folks have mentioned it throughout, but asking, people that you're working with, community partners, if what you're saying makes sense, if the language is clear. Ask a colleague who maybe has connections to the community, or has community engagement expertise, to review what you've written, or your flyer, or what you're planning to say, or your presentation, just to get that outside view. Because as we're talking, as we're communicating, I know what I want to say. I know what I want to write. So sometimes it's hard for us to kind of catch those things. Having someone else take a look will be really helpful. And lastly, a few folks have mentioned this too, just being really mindful of tone, right? Especially with jargon and things like that. We don't want to talk down to people. We want to make things accessible and bring folks along with us. So just always kind of keeping that back in mind. So all of that stuff are tools for simplification, right? Shorter sentences, no jargon, straightforward. But then there's also this other idea of resonance. And so we talked a bit about this in our breakout group, but how you really connect to people. So you've got the info that you want to share, but then how do you actually connect with folks? And one way to do that is to use words that really resonate, to use storytelling, to use emotion, tell things in an interesting way, and really, really focus on the connective part of that. So what might that look like? So you don't need to read this. This is a very dense description I just pulled from a paper, right, about diabetes prevention programs, right? And so, we wouldn't send this to a potential community partner. It's not friendly. It's got an alphabet soup of acronyms. So what might it look like to make that more resonant? So here's an example, and this is meant to be kind of a spoken example of someone who, maybe has a family history of diabetes, and they're chatting with someone. And so you can see you're identifying that here's the problem, right? Folks have a higher risk of diabetes in our community. I have personal experience with it. There's barriers, right? Like not everyone has all the time in the world or the resources to run out and prepare these like healthier meals. And then talking about how we can fix it, right? We're offering free resources, that kind of thing. So it's taking something like this that talks about the same kind of programming and just making it a little friendlier and a little more understandable. And going back to jargon again, real quick, we can't always avoid it, but if you're going to use it, define it and really try as much as possible to avoid it. So again, here's the example of incidents versus new cases. And especially when working with community partners and talking about the types of data that we're going to collect or program design, right? Thinking about how we can frame that differently. So we're going to have people complete a survey versus collecting quantitative data. So just keeping that in mind. Oops, and there's examples. One way that we can convey some of these really difficult or complex issues and make them more simple is to use comparison, right? And comparison can really help people visualize. So one thing we talked about in our group is kind of using visuals and cartoons to make that really clear. And this is kind of doing the same thing just with words, right? So if you're trying to explain stroke, right, maybe you use the analogy of like a clogged pipe, and that's something that someone can visualize. This example is from the CDC, right? So it's using this idea of defending, right, which is simpler than saying, you know, vaccines help your, you know, T cells recognize blah blah blah. And this is a cancer example, right? So explaining what cancer is to someone, it's kind of like a bully. It takes resources. It does things it shouldn't do. It's not great for the body. So really thinking about the ways that you can create kind of these pictures in people's minds of what the issue is, and that'll help you really explain this complex info. Oops, go backwards here.
Okay, so most of us know this, right? Writing and public speaking and developing this kind of content, it's really hard work, right? So it's helpful that we have somebody kind of that we can have review all these materials before we deploy them. So again, a really great tool that you can do is even use a focus group to check in with people, see their feedback. And this can be maybe the materials you use or even the actual like intervention or activity research project that you might be doing, right? And getting that feedback. And just keeping in mind that, yeah, getting edits or feedback from people, it can be uncomfortable, but it's really important and it helps your stuff, your work, your projects pay off in the long run. So it can really help identify any areas of miscommunication, flag any problematic language, and ensure that you aren't missing that kind of key information of what you want people to leave with from those engagements. So again, it can be really helpful to also make sure whoever your proof buddy is, that maybe they're outside of your field, right? It's even better if it's the person from the community you're trying to reach, but always make sure, like I always joke, like, would your grandma be able to read this and know what you're saying? Or something like that. So that's just something to keep in mind. And it can also help foster those relationships and really make it collaborative from beginning to end as you're working with people.
All right. So one thing we got a lot of questions about beforehand was emailing and just the idea of like when to email versus when to not. And so these are just a couple things to consider when you're deciding if email is the right choice, right? Instead of maybe talking to someone in person or some other thing. Always going back to if it's someone's preferred method, the purpose of the email, is it time sensitive, technological limitations. But there are some tips and tricks if email is the route that you decide to go to make things really easy on everyone. So the first is formatting, and it's to put the most important info at the top, make the subject line really clear, especially if this is a really early email to a potential community partner, right? Making it really clear like what you're reaching out about in that subject line, and making the formatting really scannable. So instead of throwing a big block of text in there, kind of breaking up the paragraphs, using bullets, focusing on the action. You know, do you need them to do something? Are you looking to set up a meeting? Something like that. Make that really clear, and then keep it brief. I think we all probably spend more time reading emails than we'd like to. So really just keeping things short and to the point. So we're sharing this, which is maybe not the best email. But if anyone wants to provide any feedback on issues that they see with this email, we would love to hear it. Thoughts?
I have one thought. I'm not sure this is what you're, the direction you're trying to go in, but the first sentence says, really great to meet you both at the health fair the other day. Wasn't it a great event? They really knocked it out of the park. Well, that's a opinion. Maybe to the people, they didn't knock it out the park. So I think that the more, that you are, sending something that's kind of arbitrary and not trying to put your own opinion in there is the best way to do it. They really knocked it out the park, which is also a kind of like slang term as well. That maybe an older person or something wouldn't know what that meant. But also, I think it's better to not be so opinionated and just get to the point, but be friendly and not use, a lot uh, of technical terms. But I don't think that you should put your opinions and things in there either, though.
Yeah, 100%. And just looking in the chat, I see also big block of text, informal for a first email. The subject could share the purpose. And good that the person added the phone number, more personal way of touching base. Yeah, all of that feedback, 100%. I agree with all of you. Yeah, there are a lot of issues. The first one possibly being the use of Comic Sans, but we will skip that one. But yeah, it's unclear. It's really casual. It's making a lot of assumptions, right? That it was a great event. Maybe not everyone thinks that. It's not scannable. There's not really any context, right? There's no so what. Like why should the person receiving this email care? And then you've got the really important ask kind of stuck down here in this PS. And the way it's written makes it sound like the reason they want to partner with these folks is to make the work lighter, not that they are interested in person's opinions or their expertise in the community. It's just, well, this is a lot of work, so like let's just make it easier. That's not great. So here's a rewritten version. And we've cleared up some of the issues, right? So we've got, it's really clear it's a meeting request. You've got a friendly opening. You've been, assuming that they chatted at this event, right? You've got it bulleted out. The formatting's clear. Here's some options. Here's a phone number. And then this ask, which was previously kind of stuck at the bottom, is reframed a little bit. And this has a little bit of a trick in here too. So one thing Dr. Sneed mentioned in her work with older folks is, names and use of titles, right? So we're assuming that the people receiving this email are okay with our sender calling them by their first names, right? So always making sure that we're addressing people how they want to be addressed, really important. So yeah, there are some tips here. There's also a resource sheet that's going to be in those free resources that we send to you all too. So we'll provide that.
And so now I want to talk for a minute just about inevitably when we're working with community partners, depending on the nature of the partnership, oftentimes it means that we have to work with them to navigate our university processes. And so depending on the nature of your partnership, your partners might have to interact with HR or payroll if you're hiring them. If they're involved in data collection, they may need to do human subjects training or interact with the IRB. If they're consultants, you may need them to do contracts. If they're actually involved in the publication process, they may need to sign forms that are related to the publication process. And so we shouldn't assume that our community partners know how to navigate our university processes, especially because those processes can vary from institution to institution. So it's really our responsibility to make things as easy as possible for our partners. And so in doing this, we should always think about who our partners are and how do they like us to communicate with them. So we have a few strategies that we think can really help to make it a little bit easier for our partners to navigate some of our university processes. First, it's really important to make sure that you're establishing a central point of contact. So you may have a large team, and ideally you don't want your partners to have to interact with 5 or 6 different people when it comes to doing administrative paperwork. So make it really clear who the contact person is on your team And if partners have questions, that they know how to reach that person and that that person is available to them. Second, we find it really important to educate your partners in advance as much as possible. So if you know, for example, that an administrator from your department is going to be sending them a contract, give your partner a heads up. Tell them, Susan is going to be the person from my office that's going to send you a contract. So please look out for an email from Susan. That can be a really easy way to let partners know what's going on. And then the third thing we wanted to emphasize also is that when you're having partners fill out forms, oftentimes the forms that we ask partners to complete can be complex. Partners aren't sure what information to put where. And so as much as possible, we want to try to use visual cues to let partners know what we need from them. So this is just an example if you have a partner and you need them to submit a W-9 form. So it's really important as much as possible, show them where you need them to fill in information. So you may need a signature from them. You may need them to fill in the dates. The form may ask what kind of entity they are. So if you know that your partner is an LLC, you might want to highlight the text for an LLC that makes it really clear that that's the box that they should check. Or if you need their social security number, make a point of demonstrating to them, like, this is the information that I need from you. Basically, it's our job to make sure that things are as easy as possible for our partners so that we don't have administrative barriers that negatively impact the work that we're trying to do with partners.
All right, and the last thing that we're going to tackle, hopefully you have a couple minutes left for questions, is just a quick note on designing visuals. We could do an entire workshop on this, so I won't spend too much time on it, but our friend Comic Sans has returned. So in general, this is just an example of a slide that could definitely be improved. So visuals can be really important tools for helping us convey messages, but people need to be able to read the visual, understand it. To Sarah's point earlier, right? Are there literacy issues? Visual cues are important. All of that is it readable for folks who may have low vision, all of that stuff. So we could take something like this that is a little less than optimal, let's say, and reorganize it and make it really clear. So some tips you can use for design is to just always make sure that your text stands out against the background, right? Really, really high contrast that helps with readability. Make sure that the text, again, like we said in the emails, is really scannable. And you kind of bullet things out, make it really easy to understand. You give people an action they can take with a shorter link. And we'll provide in the resources, I think Alex just mentioned in the chat, I have a little design guide that'll be in there too, with some resources for design. So that'll be there for you all. But the big takeaway for this is really just make things as readable as possible. Consider what the audience, what challenges they might face and barriers they might face with visuals, and try to address those as much as you can. So these are just a few resources. Again, we have a whole resource sheet that's at this bit.ly link. And right after the workshop, we'll drop a copy of the slides in there as well. So yeah, if anyone has any questions, please feel free to drop them in the chat. Use the little hand raise feature, and we'll tackle those.
And while we're waiting for questions, I'll just mention that Alex has dropped an evaluation into the chat as well. So we'd love to hear from you, what you found helpful, what you'd like to see in the future. It really helps us in thinking about how to plan our programming going forward. So please complete that evaluation as well.
I see a hand raised.
Yeah, I had a question regarding like pronouns. So I've always been told, if you're not sure, like obviously there's the formal Miss, Mrs., Mr., but I've been told now that it's more important to use their first name and last name and avoid pronouns at all. But I know there's some people that might be offended by this. So I'm just wondering, like, what would be a good reference when addressing people?
Yeah, so I think and this is my own opinion. I think it's always okay to ask someone and just say, you know, what is your preference? How do you prefer that I address you? And I mean, that can be tough, right? If you're sending kind of a cold email and you don't know. I've gotten around that before by just saying, you know, good afternoon. If someone's an academic, you can use doctor or something like that. But yeah, I mean, it's tricky because there are varying opinions. Every individual has their own preference. I think when you can I think it's okay to ask someone, right? It's better to get their take on it than to assume. I don't know if anyone else has thoughts or recommendations, because that is a tough one.
Yeah, I would agree with that. And I think that goes back to some of the communication principles we've often already laid out, you know, that if you want to communicate with people, ask them how they want to be communicated with. So ask them what they want to be called. Also, I would probably start as formally as possible and then give them an opportunity to get a little bit less formal and let you know that it's okay to be a little bit less formal. But just asking people, most people I find will appreciate that you took the time to ask, even if, you know, it's okay not to know, but, you know, it doesn't hurt to ask, and you'll be able to get a lot of information just from asking people.
Right, thank you.
Other questions?
Oh, I did want to mention, I also love the idea of, I have to send lots of forms to people for various reasons, of highlighting the areas. I know in some cases I'm able to like fill in what I'm able to, and then I send it, but to highlight the areas that they need to fill in is a very wonderful idea.
And I also even purchased like little stickers where you can actually just like stick them onto the places where you want people to sign and put the date. You want to make it as easy as possible for people to fill out forms, especially a lot of the forms we have people do are really complex. So, you know, give people the bottom line, this is what I need, and direct them to that as much as possible. Yeah. Any other questions? All right, well, if there are no other questions, all so much for coming. Again, please complete the evaluation before you go today. Again, that really helps us in terms of thinking about how to do a better job with these kinds of workshops going forward. So thank you all so much for spending an hour and a half with us today talking about communication. We hope that you learned something that will be useful to you. And like Kayla said, we'll provide you all with a link that gives you tons of resources related to all of these topics that we've been discussing that you can use and kind of help you to do a better job of navigating the communication process. Thanks for coming, everybody.